Use of computational fluid dynamics in the evaluation of hemodynamic state of left ventricular outflow tract and aorta after the Rastelli procedure. We would like to share with you some of our research concepts and preliminary findings on the evaluation of left ventricular outflow tract and aorta hemodynamics after the Rastelli procedure using CFD technique. Here is our disclosure. We have a grant support from the Ministry of Health, Saudi Arabia. As we know, the Rastelli procedure is one of the surgical procedures used to manage patients with TGA VSD LVOTO. It involves placing a patch through the VSD to direct blood flow from the left ventricle to the aorta, known as baffle. A conduit is used to establish the continuity between the right ventricle and the pulmonary artery. The malaligned and curved LVOT that results after the Rastelli procedure has been a concern. We divide the subsequent effect of curved LVOT into two categories. First, hemodynamic effect that results from the turbulent flow across the LVOT, as the flow is never as laminar as the flow across the LVOT in normal hearts. The second is mechanical or anatomical effect that results from the natural history of VSD to close, the somatic growth of the patient, and RV enlargement pushing the IV septum to the left side. Types of recurrent LVOTO. Based on this complex anatomical configuration, we have divided recurrent LVOTO after Rastelli procedure into three types. Type 1 recurrent LVOTO, in which there is only hemodynamic obstruction, which is defined as increased gradient across the LVOT, but the LVOT is widely open. Type 2 recurrent LVOTO, mechanical obstruction, in which there is stenosis in the LVOT, but without significant increased gradient. Type 3 recurrent LVOTO, in which both hemodynamic and mechanical obstructions are present. Goals of the study. Preliminary goals: to use computational fluid dynamics to model and validate flows through the left ventricle, LVOT, aortic valve, right and left coronaries, ascending aorta, aortic arch, and arch vessels after Rastelli procedure for TGA VSD LVOTO. Preliminary studies revolved around the development of methods for modeling the following. 1. The cardiac cycle through deforming geometry and computational meshes. 2. Flow characterization by definition of non-Newtonian blood flow characteristics. 3. Resistance to flow from the various branches using techniques such as Windkessel model. 4. Development of zonal large eddy simulation techniques to capture the turbulence. Final goals: to compare the flows in the anatomical configuration resulting from the differences in the Rastelli and modified Rastelli procedures. These two procedures result in different LVOT curvature. Comparisons will be made of levels of turbulence, distributions to each of the downstream branches, pressure losses, localized resistance to flow. Final 3D model in STL format, pre-processing preparing for computational modeling. Areas modeled will be used to capture turbulent structures as they evolve from the entry into the LVOT, aortic valve, coronaries, ascending aorta, aortic arch, and arch vessels as shown in the animation on the right. Computational fluid dynamic simulation. The research is being performed in ANSYS Fluent. User-defined functions was also used. All simulations are being performed using the transient solver to capture the evolution of flow patterns over time. CFD process development of the cardiac cycle, computational mesh and heart motion done using dynamic mesh simulation. The computational mesh is being developed on which the CFD solver computes its flow field. The animation on the right shows the testing that is being performed on the internal computational mesh. Currently, the cardiac cycle and the heart motion follows a sinusoidal motion. This is being used to validate the mesh deformation. For final simulation, this will be adjusted to match the ventricular volumes as observed in reality. CFD process development of aortic valve modeling using mesh zone changes to capture opening and closing. Valves are being modeled as static but cycle between open and closed positions. This is accomplished by turning off wall boundary condition on and off in two different regions, representing the closed and open valve configuration. CFD process development of a flow resistance due to vascular system using and programming the Windkessel model. The electrical analogy is applied to model the blood flow and resistance due to the vascular system. This method is used to include the effects of the downstream vascular system without creating a 3D CFD model of the entire downstream vascular system. Typically, it incorporates three major components which are shown below. CFD process development of blood properties and flow characteristics, non-Newtonian flow considerations. Blood flow is known to exhibit non-Newtonian behavior. The non-Newtonian model that was applied to the blood is known as the cross-viscosity model, which captures shear thinning. Shear thinning is defined as a decrease in viscosity with increasing shear rates as shown in the figure and equation below. CFD process development of aortic flow using large eddy simulation to capture turbulence. While the results of the animation on the right are very preliminary and intended only to validate the LES process, it is beginning to show large areas of flow separation zones. This may indicate that the turning angles of this anatomical configuration may be too steep. This sort of separation can adversely affect the flow by increasing pressure drop and inefficiency. Flow separation is characterized by the reversal of a flow and sudden drop in shear stress in the separation zone. In summary, Rastelli procedure is a complex surgery used for TGA-VSD LVOTO to better understand the flow patterns, pressure gradients, and turbulence caused by the curved LVOT. CFD simulation can be used to visualize the flow and quantify the aforementioned parameters. Current preliminary simulations are demonstrating the feasibility of the methods outlined above for a successful simulation. They are being validated and the specifics of the implementation to a full heart simulation are being developed. Once the methods are validated, the two full models for Rastelli and modified Rastelli will be assembled for comparison. Thank you.